My name is Kari Nelson. I'm a staff physician at the VA Puget Sound in Seattle, and I see patients in primary care and women's clinic. I also work in health services research at the VA in Puget Sound, and I'm an associate professor in the Department of Medicine at the University of Washington. PACT is the patient-aligned care team at the VA. It's our acronym for the patient-centered medical home model. The big picture is practice redesign and healthcare delivery system redesign in terms of primary care. And really the goals of the initiative were to increase access for veterans, to provide more patient-centered care, to increase continuity with a single provider or a team in the primary care clinics. Our evaluation team was really asked to try to answer, I'd say, 4 really important questions. Is the model being implemented as we think it is? If it is being implemented, is it helping change outcomes for veterans in terms of their health status, in terms of other markers of care, in terms of access and ability to receive care? And then also looking a lot at, did it change the experience with the primary care staff? Is it helpful in terms of our workflow and our work life to have this model? And then ultimately, are we saving costs? Are we changing healthcare use for the better? So I guess in terms of the economic evaluation, which is being led by Paul Hebert, I would say their 2-year initial findings are there's sort of a modest investment, not a lot of loss of money, and then a slight decrease in hospitalization rate. So the economic evaluation is ongoing, and they're redoing the return on investment to incorporate 3 more years of data. In terms of was this model implemented and how was it implemented, we've done a lot of work around how to measure that and how to figure that out in 900 clinics. The bottom line is that clinics that were able to implement this model showed better patient satisfaction, lower staff burnout, and better clinical quality on a lot of quality measures that the VA commonly uses, and slightly lower emergency room use. Really, the evaluation is funded through Patient Care Services, which is the operations partner. They're very integrated into the evaluation. We spent a lot of time figuring out how to give people information about what we're finding. So we have a fairly robust reporting system for feeding our information back to Patient Care Services. If you don't have clinical input into the research, it's just not going to make sense to the people who are actually on the ground doing day-to-day work. I talk a lot to my clinic director about things that we're doing with the evaluation because he is on the ground trying to run a clinic and like what makes sense to him that we're doing and what doesn't, to get kind of a better sense just sort of on the ground managers too. So trying to integrate all of those pieces is, I think, really important. I think the ultimate impact is to really improve veteran satisfaction and quality of care within our primary care system. The VA actually does really well in terms of, if you look at quality of care, we're higher or better than a lot of Medicare plans. So, we're starting with a really good system, and so we're just trying to kind of change it to be more patient-centered and try to get more sort of veteran engagement in the system. I love the VA. Most medical schools, you rotate through the VA, so I did that too. I went to the University of Minnesota, and I really am committed to public service, so I looked around for public hospital systems, and I started at the VA in Seattle about 15 years ago, partly because of that mission to serve the public, and I think a lot of people go there because of that, and they want to improve care for veterans as a particularly vulnerable population in our country. And what keeps me there is I really love my patients that I see. I've had some patients now for 15 years, which is really hard. It's just, I have patients who've been in the Normandy conflict, and, it's just great to take care of them. I really appreciate that. It's a really good part of my life. you.